taking whatever we have and like pick through it and get to a couple of simple quotes from you, like maybe minutes, and then take whatever we talked about and make it into something shorter, maybe about 15 minutes or something like that.
Okay.
So before we sort of talk about your leadership in this particular environment, my goal in these interviews is about how you woke up one morning and realized COVID was going to be a big issue in your organization, in your community, and like, wow, what kicked in? But before we get into that, I'd really like to hear a story, if you could share a story, any story that illustrates your evolution as a leader, or how you see your leadership style today.
So, oh, wow, I don't think that was on that list of questions, was that, huh? So my leadership story centers around being in the military healthcare system. And so I was raised as a leader in that system, and we're, very servant leadership, mission first, people always is the leadership philosophy that I have grown up with, but probably in a very rigid system where everything is very black and very white. And I, my leadership philosophy especially is an experience of being a parent going through a healthcare system that can be very complex, very frustrating, on the side of the consumer versus being an administrator, has really taught me that healthcare is really probably more gray, and that there are rules and regulations in place to keep patients safe, to keep staff safe and accountable to the care that they provide. But there also is this element of gray, and it's meeting patients where they're at in their own personal healthcare journey, whether it's on the preventative side or whether it's on an acute event, like as in a hospital admission. And so really, looking at the rules and what makes sense because you must comply because it's a law, versus what we put into place because we thought it was appropriate at that time. But not all processes fit all patient situations. And so I think really over the years, I've become a lot more flexible, a lot more adaptable to change. I love change, which probably makes me an anomaly in leadership, because a lot of people are very resistant to change. I thrive off of change and the ability to adapt. And I'm competitive. I like most nurses, and I like to be first. And so one of the things that I really work with my team with is about the fact that change is inevitable in healthcare, and the only constant that we can rely upon is that we will change because we need to get better. And so I think that over the years, I've become a lot more flexible. Now this is my first civilian healthcare job coming out of the military. And so the rules are similar, but not identical. And I think here it's a lot more focused on growth and development. I see one of my strengths as being from where I've come, and because the military invests so deeply in their leaders. I have 26 and a half years of leadership development. They start developing us on day one. And so now my role really is about teaching what I know to younger leaders, and then preparing the next bench strength. Because as much as I would like to say I'm going to work forever, my intent is not to work forever, because this is my failed retirement job.
But you had a lot to get into right now, starting in March. When did you realize you were going to have to implement change and be extremely flexible in a very uncertain environment when COVID hit the hospital?
That was on March the 13th, and I had been at the hospital, actually boots on ground, for about 3 weeks. And we really started to see the changes happening in Northern Virginia, and in concert with the Virginia Department of Health, looking at the number of cases that were in Virginia as we started to peak. And that also happened to be the week where I was admin on call and my boss happened to be away for a couple days, and so I hadn't been here very long, and we needed to make some decisions in order to safeguard the community and to safeguard our patients. And I remember looking at my two colleagues and I said, well, who's going to make these decisions? I haven't been here but 3 weeks, and surely I'm not the most qualified. And they said, well, you're admin on call and you've got this in your military background, so all the decisions are yours. You decide whether or not you're going to close the hospital. And so I took a really big breath as the room was full of people looking at me, and they said, okay, we trust you. And I said, we're going to close down the hospital. And then I called my boss, and the silence kind of ensued. And I said, this is what I decided. We shut down the hospital to all visitors, which was a big deal because, not a community satisfier. And I think at the early, around March 13th, people really didn't understand what COVID was. They didn't really, none of us, there was no playbook. We didn't really understand, fully what was the best thing to do. But the one thing that with the consultation of my team that I realized is the less people in the hospital, the safer it was going to be, not only for the patients, but as an obligation to protect my staff, because the last thing that I needed was a outbreak of COVID amongst my staff, because with the patients coming in the door, I needed to have a fit and ready nursing force to be able to take care of them. And, as the CNO, obviously my first responsibility is, to my nurses, but as one of the administrators in the facility, it's for the health of every single person, because there are so many different disciplines that work together to execute healthcare for all the patients in Fauquier County.
That's interesting, because a week before that, I was in my leadership cohort. We were meeting at the fire station and it was Public Safety Day. And I have two cohorts, Vicki Thompson and Kelly Yoder were both in the class, and they're like, oh, nothing's going on. And we were just having our normal day. That was the last day we met as a class in person. And it's interesting to then hear you say you've made this decision a week later to close the hospital down. So where did you find the I don't know what would have been the feeling that you had, or the sense, or what told you that you were making the right decision, or how did you find that strength to stand up and go, I'm making this decision?
Well, my experience in the military, so I was in South Korea when H1N1 pandemic hit. And so at that time, funny enough, my boss was away. And so I was responsible for planning for our operations for the hospital at that time. So really it was reach back from the H1N1 pandemic. What did we do then in order to safeguard our hospital and our staff? And then, I've been in, of numerous other contingency operations. I was in New Jersey when Sandy hit, and was involved with those planning efforts. I was in a pretty pivotal leadership position there, and was responsible for going our ambulance team to go out and retrieve folks during Sandy. So I think it was a combination of my past military experience, and this is the bread and butter that the military trains for, whether it's something that happens stateside or a deployment. I think it just worked out to be good timing that, I started Fauquier in March, COVID hit, or in February, COVID hit in March, and I retired from the military on the 1st of April. So I think it was, an interesting plan for me to arrive here at the timing that I did. And, I think just like everybody, you plan, you exercise, you train, but you never think you're going to have to use the skills that people give you. And then, then one day you find yourself in the middle of a pandemic in the United States, and there you go.
So what did you learn? I mean, normally I would ask, what did you learn about your organization? Well, you didn't know your organization yet. So you really were learning about your organization during a crisis, instead of just going through the usual, I've been here for 10 or 15 years. So I guess you learned a lot very quickly. And could you tell us a little bit about what you did learn?
Sure, I did. I learned about every facet of the organization. I learned where they had planned. I identified where we had opportunities. I think it was, a really interesting time and a great way to sort of enter an organization, in the midst of crisis. And, my boss, was very trusting of letting me take the lead in the planning. And the part that I really thought was just fantastic was how open everyone was to my input, how much they were willing to collaborate, to teach me, to sort of bring me into the fold, and then, trust what I was saying based on the input that they were giving me. And so I learned a lot about teamwork, networking across the system, finding out who my resources were, and, the partnership with Virginia Department of Health, especially in the early months where, we, like everyone, you sort of felt alone on the island. You're trying to read everything you can in the internet, try to assimilate what was coming out of the CDC and then put it into practice. And so having the epidemiologists to be able to partner with, and, to be able to determine a response plan and to be able to have that, the opportunity to bounce ideas off of people was really helpful. But I was really impressed at the caliber of leadership team that we had at Fauquier and their willingness to work hard, dig in, and so creative in some of their approaches. We realized really early that we needed barriers for the registration staff who are the front line when the patients are coming in the front door, whether in the ED or the front door. And, we made a statement, wow, we need a barrier. And it was before all the plexiglass that you see now out and about in the community. And they went and bought wood and plexiglass, and they fabricated these great barriers for our staff. And I was just so impressed because it was just a passing comment. And within 2 hours, we had the entire hospital set up with these plexiglass barriers, which, as the product became available, on the commercial side, we changed out. But just to see that kind of creativity to be able to safeguard people was really pretty phenomenal.
I've known this hospital. I gave birth to my third son. He's now 32 years old at Fauquier Hospital. So I watched this. And my first son was born at Tripler Army Hospital.
Oh, very cool.
So quite a difference in experiences, needless to say. But I've always seen that sense of community in the hospital. No matter what, we have our good times and our bad times, but it sounds to me like you experience what I've kind of known about our hospital and I've seen over the years. So that's good. What have you learned about the community being here now?
When I was hired for this job and I started, I think it was somewhere in the middle of the COVID pandemic, I asked a random question. It'd been a really long day in the incident command center, and I looked at some of the directors who had interviewed me, and I said, so why did you hire me? Why did you pick me? And they said, because we could see you at our dining room table eating dinner with us. And that's what, we use as a marker, besides professional competency and all of that. But can we see you being a part of our family? And, that really hit home with me. Because in the military, you don't have a choice of who you hire. You get who who the military sends you. And so, that was just really, it just hit me really hard because, I think at that point I realized, that they have a choice and they choose the right people, the right fit for the culture and the community. And, one of the most amazing days that since I've been at Fauquier Health was the Light the Night, which was that joint effort with the hospital and EMS and fire and police and the community, thanking all of us collectively together. And, I think it was an hour and a half or 2 hours, 200 cars that drove through to see all of us. But it was so great to see the entire EMS response personnel, fire and police and hospital all together, and then the community showing that outpouring. And I mean, that was really significant for our staff, the number of meals and thank you, gifts and, church groups that made masks and hats for the staff. I mean, was just, it was just this incredible outpouring of thanks and appreciation. And, I think what I've learned about this community is, and was a little bit my bias, I wasn't sure how welcoming a community, a small community would be to basically a stranger, an outsider. And, would I be able to be impactful? Would I be included, or would I always be on the periphery? But what I learned was that the community is very welcoming, just like the hospital, and, interested in other people's thoughts, ideas, perceptions to make things better, and to build even a bigger, brighter community.
That's a good thing to hear. It's something that I've kind of known for quite a while. And I would say that the majority of my 5 cohorts have always leave the program going, wow, I didn't realize what we have here. I do a little presentation on community capital, and people normally think of that as the money you can raise and, kind of infrastructure tangibles, but we don't ever look at the human capital and the social capital and the cultural capital that we have that we can really put to work. You've probably seen some of that, haven't you, since you've been here?
Mm-hmm, absolutely.
So everybody's been painting these rosy pictures of getting in there and just getting the job done. And I know that every day wasn't like that. So are there any lessons that you learned? Was there a time when you put your hands up and said, oh my goodness, or wish that you had done something different? Do you have anything to share from a lessons learned story?
There were definitely days where the task seemed so great, where the obstacles seemed large. And I think, as far as lessons learned, listen more, slow down, would be 2 things that I think were good lessons learned. I think that, we made the best decisions based on the information that we had at the time. I think one of the things for me that was really very reassuring was, as the weeks developed, we were one of the first hospitals to shut down the hospital. We were one of the first hospitals to move out on our personal protective equipment. We never had a problem having equipment for our staff because of the way that we utilized our resources. But what was really reassuring is when I was on calls for whether it was with the CNOs or the general COVID planning with all the other hospitals in Virginia, when they would talk about a good idea, we actually, in every single one of those meetings, my team and I would look around the room and we're like, we've already done that. We've already implemented that. We already thought of that. And then even, when we started we're part of a larger healthcare system. And when COVID started to impact our other hospitals, and we were on those meetings, it was that we were actually feeding them our playbook. Here's our playbook. Here's what we've done. Here's what we learned, about, how important technology was going to be in this fight for us, because, now there were new jobs that needed to be done, screening patients, screening visitors, and, how could we deploy technology? I wish that we had deployed our technology a little bit earlier. It would have conserved some of our resources. Now you walk through the hospital, a camera takes your photo, or not your photo, but a camera takes your temperature, where at the very early part of it, we were taking everybody's temperature. We went from taking it orally to the tympanic, we did ear, and then we're like, okay, we're not being able to maintain social distancing, so what's the better way? And our tremendous IT folks are like, there's there's technology. We can actually do it infrared from a distance. And so, we were able to put those in at our employee entrances so that staff could quickly get into the building, attest to all of the safety requirements, that they are asymptomatic and they haven't had a positive test. So we were able to get all of those things done with really just kind of keeping back to normal ops. And I think the other lesson was that we needed to accept that this is the new normal and move forward. There were certain things that, we prioritized lower for all of our COVID planning. And so it took us a little bit to get back into just what some of our normal operational tempo was, because, it felt like, it was all about COVID. And so really getting back to normal a little bit sooner, and knowing that the workflow is just different. Everything in healthcare right now is just harder when you're dealing with COVID. And so I think that would be the biggest lesson that I learned was you gotta push forward a little bit quicker to get back to normal so that you don't lose sight of all the facets that you need to be paying attention to.
So how do you keep a focus on strategic while you're in the middle of a crisis? I mean, I'm sure there's things you came into this position wanting to do and hoping to do, and you've been managing a crisis. Do you have time to think forward in a strategic plan?
We do, and we did our strategic planning. It was a little bit different than we've done it in past years because, of course, everything from COVID impacts our future strategic planning. For a period of time, we had no elective surgeries coming in-house. Obviously, that's tied to our strategy because, one of our bread and butter is our surgery throughput. And so it took a little bit to get back on track of the strategy. And, I think it was, for me, setting new expectations for myself, setting new expectations for my leadership team. And, interestingly enough, just last week, we got to do an inspection. So we actually were in the middle of a crisis planning for an inspection, our accreditation inspection. So I think that it was reprioritizing what was really important. And what was important are the patients and the people. And then getting through the pandemic, the rest will follow. It's a little slower. Some things that I've wanted to do, I haven't been able to do. It's frustrating on days because I'm like, ooh, I wish I had more time. I've been here 9 months. I should have, got our nurse residency program launched. I should have fixed our clinical ladder. And so I think it's just some of it of setting expectations that I am, not here for short term. I'm here for the long haul. I consider myself a member of this community, a member of this hospital. And so it's definitely not a sprint, it's a marathon. And so slow and steady will eventually make progress. So it's just resetting expectations for all of us that, 2020 is going to be all about how great we did in demonstrating teamwork and resiliency and managing through a pandemic, and everything we're doing in 2020, instead of looking at it as, wow, we didn't get to do everything we planned, the way I'm shaping it is, this is how we're planning to come out of the gates in 2021 ready to roll.
That's a good way to end. That's great. The manage expectations a little bit here. So where do you go for inspiration or clarity when you get yourself into that stage of, wow, what do I do next? Make a decision. Where do you find your inspiration or clarity?
Definitely with my nursing leadership team, my directors. They are brilliant. They are amazing. And they, being that there's so many things that are different between military and civilian healthcare, they really have done a tremendous amount to assimilate me, to transition me to this new role. And so I'm just amazed and inspired every day about how much they know about their service lines, how much they know about their people, how committed they are to the community. And, you know, for me, it's just inspirational because I can see the next CNO, the next CFO, the next COO, and, you know, it's just really awesome to be able to have a part in mentoring the next round of leaders. And, you know, the nurses that take care of our patients every day on the front line, you know, I just am amazed. You know, I was a frontline nurse 20 years ago. I'm a nurse practitioner. And so I haven't been at the front line at the bedside in 20 years. And I mean, the job is a lot different now than when I was at the bedside. The amount of information that they need to know, the technical competence that's required, the emotional intelligence, the compassion, the family complexities, and then dealing with things like insurance and CMS and placement. You know, they really are an inspiration because the nurses that are having to care for patients at the bedside today are so much more advanced than when I graduated from nursing school, you know, some 27 years ago. And so on days that I'm frustrated from an administrative standpoint, I think about my team that's up on the floor, holding our patients' hands, watching new life come into the community, being just the sole source of comfort and security for patients is what I find inspiring. It's why I entered nursing, to help people, to be there for people when they need us the most. And sometimes that's the most difficult time, to be there for patients.
I'd like to wrap up with your thoughts. You've got a live audience, well, a big audience here listening to you today. What little tidbit out of all of our conversation would you like people to remember? What takeaway would you like the people out here in our community who are leaders in our community to take away from your experiences?
I think that what I would like people to take away is that it's about community, it's about working together, it's about understanding that during this pandemic, during any crisis, that decisions have to change quickly, that, you know, being accepting of the fact that we need to be very agile in our decisions, we need to be very agile in how that impacts our community. But I think just in people knowing that, you know, maybe not everybody agreed with all the decisions that we made, like, you know, limiting visitation for patients and, you know, not quite understanding why every single person that comes in the community into the hospital needs to be masked, but understanding that, you know, these were decisions that we made to make sure that the community stayed safe. And, you know, when you look at the numbers across Fauquier County, especially compared to our neighboring counties, we did really well as a community of keeping each other safe, of keeping each other healthy. And we're not going to suffer from some of the stark numbers of losses from COVID, because we all were respectful of the decisions that were being made by the leaders in this community. And so I think, you know, just for the community to continue to be vigilant, because, you know, they are projecting still another round, another peak, since, you know, the vaccinations aren't going to be available. Now they're saying Q2 or Q3 of next year.
Yeah. Well, thank you. I'm going to turn the recording off.
Perfect.
We got a lot of really good stuff. Yeah.
I hope so. I hope you got something.